Hello, my name is Noor Hassan and I'm doing my topic on herpes and public health. First, I'm going to address the public health problem, which is herpes. The virus originated in chimpanzees jumping into humans about 1.6 million years ago. There are two types of herpes, HSV1, which tends to be an infection occurring around the mouth area, and HSV2, which tends to be around the genital area. Now, how did the disease happen? Well, a team of scientists from Cambridge and Oxford Brookes University believe they have identified the culprit, Paranthropus boisei, a heavy-set hominid with a smallish brain and a dish-like face. Close contact between P. boisei and our ancestor Homo erectus would have been fairly common around sources of water, such as canyons like Turkana. This provided the opportunity for HSV2 to boomerang into our bloodline. Now, where did the disease occur? Initially, the virus was first introduced in Africa, but now it has become a worldwide public issue. However, it is worth noting that HSV2 is more virulent in sub-Saharan Africa than other countries such as the US. The future risk for the community is that it can cause infants to be born with infection if the mother contracted the virus prior to giving birth. It is also very contagious and heavily impairs the immune system if not treated. The etiological factors include any risk components associated with the disease. In the case of HSV1, risk factors include any activity that exposes one to an infected patient's saliva, shared drink of cosmetics, or mouth-to-mouth contact. In the case of HSV2, the biggest risk factor is the number of sex partners in a person's lifetime, unprotected sex with the person who has it, or prior sexually transmitted infections. There are two strategies that I propose, the first one being suppressive therapy. There is no absolute cure for herpes. However, according to the Center for Disease Control and Prevention, taking daily suppressive therapy may reduce the risk of transmitting the virus to a sex partner. Antiviral drugs also reduce viral shedding when the virus makes new copies of itself on the skin's surface. The second strategy is by safe protected intercourse, or absence from intercourse. The most effective method of reducing the risk of genital infections is by obviously avoiding vaginal, oral, and anal sex, especially with an individual who has herpes. Condom use also decreases risk, but not entirely. The first historical example I found was from the initial introduction of herpes antiviral therapy. Beginning in the early 1960s, the experimental use of medication interfered with viral replication called DNA inhibitors. The original use was to fight against fatal diseases such as keratitis, but soon after expanded to include topical treatment of herpes simplex. The introduction of viridipin preceded the way for the beginning of regular neonatal antiviral treatment for herpes. Intravenous viridipin was then licensed for use by the U.S. Food and Drug Administration in 1977. In the 1990s, however, the FDA found the drug acyclovir to be less toxic, making it the drug of choice for herpes treatment after it was licensed in 1998. The second historical example I found was from the establishment of the National Herpes Research Center. The organization arose from the American Sexual Health Association, which was created in 1914 in response to the increase in sexually transmitted diseases in the nation, one of which being genital herpes. The center was created in 1979, which was designed to meet the growing need for education and public awareness about the virus. The Research Center offers accurate and up-to-date information about herpes, source for referrals such as local support groups, voice to increase public awareness about herpes issues through the media, and to advocate for responsible national policies for STD treatment. Since its formation, the HRC has helped over 5 million people. According to Adrian Mindell, one strategy that is likely to have an impact on the transmission of herpes is vaccination. A therapeutic vaccine that reduces symptoms of the disease, shedding, and transmission would be a major advance, both for the patients and as a public health measure to reduce spread of the virus to unaffected individuals. Although such a vaccine is not available yet, the only control strategies currently available are the use of condoms, abstinence or reduction in sexual activity, or the use of antiviral drugs to reduce clinical recurrence and symptoms of viral shedding. Because the herpes virus is very complicated, it has been a very difficult task in finding the right vaccine. There still needs to be more intensive clinical research to find a vaccine sufficient enough to combat the tough virus. My opinion on this issue is that research clinicians should adopt a public health perspective in managing patients to help prevent transmission. One concept that I learned in my psychology class was the PLICIT model, which is used for sex therapy. It stands for permission, limited information, specific suggestions, and intensive therapy. It is a model developed by psychologist Jack Annan to address sexuality issues with patients. The model includes 4 levels of intervention, ranging from basic to complex. It guides clinicians to support patients according to the unique needs of individual patients, as well as the clinician's own comfort level and expertise. And last but not least, this is my references page. Thank you all so much for watching my video regarding herpes and public health. I hope as a future public health professionals we can help solve this worldwide epidemic.